Hi, I'm Ellen and welcome to Mentally Detoured. The topic today is what to do in a mental crisis. When you are experiencing a crisis for a loved one, for the first time, the natural instinct is to panic. If you yourself are experiencing a mental crisis, it will most likely be someone else who is going to get you help. I'm in the process of putting together a list of state crisis line phone numbers and will have them listed on a page on my blog. As of the time of this video, April 28, 2015, the list is incomplete, but will be posted anyway as I continue to fill in the blanks. Some of these state numbers are easy to find, and others not so much. But let's start with suicide first. Whether it's you or someone else that's suicidal, call the Suicide Prevention Lifeline 1-800-273-8255, which is 1-800-273-TALK. You can also reach them directly from their website, suicidepreventionlifeline.org. Calls to their 1-800 number are routed to the closest available crisis center in the United States to you. They have 165 crisis centers in 49 states in their network. I'm finding that most state behavioral health departments also link to this number as their primary suicide crisis line. There is also a crisis text line. Text the word START, S-T-A-R-T, to 741-741. And if it is a life or death emergency, call 911. But what if you're experiencing an emergency that is not life or death and you don't want to call 911? Surprisingly, or maybe not surprisingly, given the state that our mental health care system is in now, sometimes these numbers aren't that easy to find. My own state, Georgia, has a crisis and access line which offers to help 24/7 for problems with mental health, drugs, or alcohol. This number and their website, mygcal.com, are sponsored by the Georgia Department of Behavioral Health and Developmental Disabilities. Not every state has a single number like this to call, though I am finding that some list their crisis line numbers by county or region. Some of the reasons to call the Georgia crisis line, for example, provided you live in Georgia obviously, would be if you or someone you know threatens or talks about hurting or killing themselves, feels hopeless, feels rage or uncontrolled anger, feels trapped like there is no way out, engages in reckless behaviors, increases alcohol or drug use, withdraws from friends and family, feels anxious, agitated, or unable to sleep, encounters dramatic mood changes, and or sees no reason for living. Back to the panic. Not panicking is really good advice, but the first time your loved one experiences a mental event of some sort that has you heading to your phone or the internet can be an extremely stressful time. Before the second event happens, having a plan in place can really relieve some of that stress and reduce the fear of the unknown. Okay, that's it. I'll keep updating the crisis numbers or crisis information for the states as I find it. My plan is to have the list complete by early May 2015. And let's hope you never have to use these numbers. Until next time.